Assalamu alaikum. I am Dr. Mohammed Prince Sheikh with you on behalf of the Healthcare House. Today's topic: how to recognize the symptoms of dengue fever and take first aid at home. Introduction. Dengue fever is a mosquito-borne viral infection that is a major public health concern in tropical and subtropical regions worldwide. It is estimated that approximately 390 million dengue infections occur annually, resulting in an estimated 20,000 to 25,000 deaths. Dengue fever is very common in Bangladesh. Frequent rains, a tropical environment, unplanned urbanization, vacant houses, and improper waste disposal leave lots of room for mosquito breeding. Transmission. Dengue fever is transmitted through the bite of an infected female Aedes mosquito. The mosquito becomes infected when it feeds on an infected person and ingests the dengue virus. After an incubation period of 4 to 10 days, the mosquito can transmit the virus to other people through its saliva. Symptoms. Dengue fever symptoms typically show up 4 to 10 days following the mosquito bite. There are 3 phases of dengue fever symptoms. Febrile phase. This phase is characterized by the sudden onset of a high-grade fever, typically ranging from 39 to 40 degrees Celsius, may be biphasic, and lasts 2 to 7 days. Other symptoms during this phase may include headache, red face, eye pain, pain around the eye socket, nausea and vomiting, muscle pain, poor appetite, joint pain, bone pain, petechia or numerous tiny red rashes, flare-ups of the body's skin, abdominal pain in the right rib region, and tenderness around the epigastric area are possible. The critical phase. The critical phase is the most important period that needs to be identified. Failure to detect and treat this phase may lead the patient to severe dengue causing death. Most infected people do not enter this phase, which occurs around 3 to 7 days after the febrile phase. The critical phase begins when the fever starts decreasing or when the patient becomes febrile. It lasts for 24 to 48 hours. For the duration of this period, plasma leakage takes place, resulting in periorbital edema, pleural effusion, ascites, and surprise. Symptoms during this phase may include severe stomach pain, especially in the right upper quadrant, caused by an enlarged liver, persistent nausea and vomiting, anorexia, abnormal bleeding, bleeding gums, nosebleeds, plus bloody urine, stools, or vomiting blood black vomit, melena, petechia, or a large number of little red dots on the skin, breathing difficulty, rapid breathing, restlessness, fatigue, weakness, and lethargy, cold extremities, sweating, decreased urine output, rapid pulse, a large amount of menstruation or a prolonged period of menstruation in females, hypovolemic shock, which typically occurs 38 days after the onset of high fever. Fever drops quickly, often in conjunction with shock. Gastrointestinal bleeding, often associated with shock. Blood strain fluctuations, incapacity to degree pulse, or low blood stress in those with intense signs of circulatory failure or dengue shock syndrome. Potential death. The healing segment is the very last stage of dengue fever, lasted for 2 to 3 days after critical phase. Individuals who have passed the febrile phase without entering the critical phase, or those who have recovered from the critical second phase for 1 to 2 days, will reach the recovery phase. During this phase, the body gradually recovers and various symptoms of dengue fever gradually improve. Blood vessels regain normal wall integrity. Signs of the recovery phase include overall improvement of symptoms, the fever subsides, and the body temperature returns to normal. Blood pressure and pulse rate rise. Increased urine output. The size of the enlarged liver shrinks within 1 to 2 weeks. Improved appetite. The appearance of small white skin patches within a larger red area. The severity of dengue fever can be divided into 3 grades: denguefever without danger signs, Dengue fever with dangerous signs, severe dengue. Dengue fever without danger signs. Initial symptoms of dengue fever resemble an undifferentiated viral fever. Symptoms include high-grade fever, severe headache, retroorbital pain, myalgia, arthralgia, nausea, vomiting, and rash. Fever is usually between 39°C and 40°C, may be biphasic, and lasts for 3 to 7 days. Diffuse erythema and fleeting eruptions can be located within the initial days of fever. In the convalescent period, normal skin surrounded by erythema, white islands in a red sea may be observed. Skin itching, especially over the soles and feet, is found during recovery. The scientific path of dengue fever varies between individuals. However, the febrile phase lasts for an average of 5 days. Fever persisting for more than 6 days should be investigated for other causes. Bradycardia may be found during convalescence. In dengue endemic areas like Bangladesh, a positive tourniquet test has a higher positive predictive value for dengue infection. A tourniquet test is done by maintaining an inflated blood pressure cuff between systolic and diastolic pressure for 5 minutes. The test is considered positive if 10 or more petechial rashes are present per inch square around the skin where the cuff was applied. This test may be poor in obese sufferers and a profound surprise. Dengue fever with dangerous signs. Danger signs in dengue fever includes persistent vomiting, abdominal pain, and tenderness, being unable to take orally, bleeding from any site gum, epistaxis, melena, or hematemesis, severe lethargy, being unable to walk, restlessness, ascites, pleural effusion, narrow pulse pressure, hypotension, and tender hepatomegaly. There is also an increasing hematocrit and a rapidly falling platelet count. Skin hemorrhages may be present as petechia or through a tourniquet test. Mild epistaxis and mild hematemesis should be observed closely. Because the affected person becomes infertile, there is probably some plasma leakage. Circulatory disturbances might be observed in the first 24 to 48 hours from the time of fever lysis. It may be associated with sweating and circulatory disturbances. These should be differentiated from severe dengue. Severe dengue is present with either or all of cephalowing, severe plasma leakage, and severe bleeding, severe organ involvement. Severe dengue fever, dengue hemorrhagic fever. In some cases, dengue fever can progress to severe dengue fever, also known as dengue hemorrhagic fever DHF. DHF is a more serious condition that can lead to severe bleeding, organ failure, shock, death. Diagnosis. Dengue fever is diagnosed based on a medical history, the symptoms, and a blood test that detects the dengue virus. A tourniquet test can be done at home. Examination for bleeding spots under the skin using a tourniquet test. This test involves using a tight band or a blood pressure cuff wrapped around the upper arm for 5 minutes. The test is considered positive if 10 or more petechial rashes are present per inch square around the skin where the cuff was applied. This test may be negative in obese patients and cause profound shock. Complete blood count CBC to check for changes in blood components such as platelets, red blood cells, and white blood cells. A higher hematocrit concentration of red blood cells and a lower platelet count could be signs of dengue fever, which is caused by blood vessel leaking. Specific immunological tests for dengue fever, such as dengue NS1 antigen, are positive within 48 hours of infection and become negative for a few days of the febrile phase. Dengue IgM is usually positive by the 5th day and may remain positive for up to 60 to 90 days. And dengue IgG rises after the first week and remains positive for life. Cross-reactivity for both IgM and IgD occurs in other flavivirus infections. Detect antibodies produced by the body in response to dengue virus infection. Molecular genetic testing, such as polymerase chain reaction (PCR), detects the genetic material of the dengue virus. This test is usually done in the early stages of symptoms to confirm the disease and identify any of the 4 strains of dengue viruses that are the leading causes of dengue fever. Treatment. Management of denguefever. Even though dengue is a multisystemic and complex disease, correct and timely management saves lives. It is critically important to identify the phase and severity of illness and treat it accordingly. The doctor will treat dengue fever to help the afflicted person return to normal as soon as possible after the diagnosis has been established. When a patient is diagnosed with blood vessel leakage and exhibits symptoms from both the critical and febrile phases, the doctor will intensively follow them for the next 24 to 48 hours to prevent shock and provide treatment using the following methods. Advise patients regarding management at home. When a patient is suspected of having dengue fever and there are no danger signs, they can be sent home with written advice. 1. The patient should take adequate rest. 2. Paracetamol is the sole drug that is advised for fever. Do not use non-steroidal anti-inflammatory drugs or steroids. The maximum dose of paracetamol, 4 grams per day, of adults, and 1015 milligrams per kilogram a dose, with a maximum of 5 doses in 24 hours in children. Paracetamol and other medications should not be given intramuscularly (IM). Fluids should be taken adequately. Oral rehydration solution (ORS) is the best fluid for rehydration. Other advisable fluids include coconut water, milk, and fruit juices, which are better than plain water. In cases of vomiting, it is better to avoid red and dark fluids that may mimic blood in vomitus. ORS should be diluted according to the direction in the cover without additional solutes. 4. Tepid sponging may be done if fever recurs within 4 hours of the paracetamol dose. Come back to the hospital as soon as possible if you find any of the danger signs mentioned below. The general condition worsens, especially when the patient becomes afebrile. Monitor the symptoms. If the fever is high and does not respond to medication, see a doctor. Persistent vomiting, severe abdominal pain, unable to take orally, bleeding intermittently from any place, including the nose, vomit, or feces either red or black, bleeding between periods and menorrhagia, severe lethargy or being unable to walk, restlessness or disorientation, unusual behavior such as inappropriate language, cold, clammy hands and feet, no urine output for more than 6 hours. 6. Even if there are no danger signs as mentioned above, if the fever persists for more than 3 days, the patient is required to review with a doctor. Fever for more than 3 days requires blood investigations. 7. Patients who are on antithrombotic agents such as aspirin, clopidogrel, dipyridamole, etc. should be discussed with physicians regarding withholding the drugs in thrombocytopenia. In addition to the treatment, periodic blood tests are required to monitor thrombocytopenia, low white blood cell count, concentrated red blood cell count, or low blood pressure. Prevention. Remaining away from mosquito bites is the best defense against dengue illness. This can be done by using insect repellent, wearing long-sleeve shirts and pants, using mosquito nets, eliminating mosquito breeding sites, for example, standing water. Vaccination. There is a vaccine available to prevent dengue fever. The vaccine is recommended for people who live in or travel to areas where dengue fever is common. Conclusion. Dengue fever is a serious health concern that can have significant consequences. By taking steps to prevent mosquito bites and by seeking medical attention promptly if symptoms develop, we can reduce the risk of infection and its complications. If you like my page, then follow the page to get regular health messages and tips. Thank you.